Hi, I'm Alexa. I'm a patient of Dr. Haddock's. In July of 2021, I was diagnosed with invasive ductal carcinoma. It came as a complete shock, and it was caught as a result of a routine mammogram. So first, I want to say all women never, ever, ever miss your mammograms. And I did not, thank goodness. I was faithful every year. Did not have a history of breast cancer in my family. Breast cancer was not on my radar, so it was a total surprise when I got the call and they told me it was invasive. I'm not gonna cry, but that leads to a lot. It leads to a lot. Anyone who's been through it knows. And I was at my office the day I got the call and in shock, didn't know what to do. The doctor on the other end was telling me, here's the name of a surgeon, she's good, I recommend her. So I went to a conference room and made an immediate appointment and decided, well, I don't want to rush out of here in a panic. I don't want to call and tell my family over the phone, so I'm gonna sit back down and finish my work day, which is what I did. I called and made the appointment with that surgeon, finished my work day and went home and told my husband, and our kids are grown and all live out of state, and proceeded to call each one. Well, it just so happens one of our daughters is a surgeon and did a residency here at UT Southwestern. And when I told her I had already made an appointment with a surgeon, she said, what? Back up? No, cancel it. I'm sure that person's great. You're going to UT Southwestern. And so that's how I got introduced to Dr. Haddock through Rachel Wooldridge. She sent me to Dr. Wooldridge as my surgeon. And then between Dr. Wooldridge, myself, my daughter, we picked and chose the UT Southwestern team for me. And Dr. Haddock was my person, was my doctor. I'm forever grateful to the whole team because they've been amazing. Dr. Wooldridge, she insisted I interview everybody basically, all doctors. Even there was a possibility I was looking at radiation, even those doctors, until I made my final decision on what type of surgery I wanted and how I wanted to be reconstructed. There's so many decisions that someone coming into this has no idea, myself included, because if you've never faced it, why would you know? I was shocked at all of the choices that I then had to make. My surgeon daughter, honestly, she was shocked too. She knew a lot of these surgeries, but she thought I was going to just come in, have a lumpectomy, overdone. No, I chose double mastectomy. I chose double DIEP flap. I went, I guess you would say, the hard route. For me, it was the right decision because I wanted to minimize my chances of facing this again. Obviously, no guarantees in life, but it was the right decision for me. So Dr. Haddock, when I chatted with him, he was very patient. He went through the whole gamut of reconstruction choices that I would have. I remember asking, who really makes this decision? Is it me or the insurance company? And he said, well, there are laws that protect women, and there didn't used to be. I believe these came into existence in the 90s, so not that long ago, where the patient gets to make the choice of what you want. And that was a big relief to me. I did not know that because as I'm listening to him, I'm thinking, why are we talking about this? Because we all know how insurance companies are and they're gonna pick and choose, but that is not the case. So I went with double DIEP flap for my reconstruction. I was lucky in that because they found it on a routine mammogram, it was early. And I was able to have an immediate DIEP flap, which means right after mastectomy, before you're awake, then Dr. Haddock and his team comes in and works their magic, shall I say, which takes hours for a DIEP flap, and especially on both sides. And so when I woke up, I didn't go through what a lot of women did or do go through, which is you have no breasts, it's a different look. Yes, I had a different look, but not so different. It was still my skin. I could tell it was me. They had just moved things around. So when I woke up, I didn't have some of the emotional, I don't know, for lack of a better word, trauma that others maybe go through. And I was very, very appreciative of that. That meant a lot to me. I know not everyone's a candidate for immediate surgery. Usually these things take time. And I did have to wait 3 months, I believe it was, for the next surgery. I call it my Humpty Dumpty surgery, where he was going to put me all back together again with all the parts and pieces. You get an umbilical, not a cord, but you get the belly button look, nipples, whatever you choose. And that was 3 months after the mastectomy and the DIEP flap surgery. I did struggle when it came time for the second surgery to decide what I wanted. If I wanted to be fully put back together, if I wanted nipples, if I didn't, if I wanted the belly button. You don't have to have any of that. But Dr. Haddock was very patient with me, and I asked him what is recommended. He said it's recommended. You have nipples, you are fully put back together. He recommended tattooing, doing the nipples, getting the tattooing, and ultimately I followed. I just trusted his advice, and I took his word for it, and I let him do the surgery, and then I followed through with the tattooing, and I've been very, very happy with the results. It takes a while for all the swelling and for you to actually see, once you go through this, how you're going to look. Honestly, I remember thinking, I look better than I did before. And all that is thanks to Dr. Haddock. He's very artistic, he's very patient, he's very kind. Honestly, my whole UT Southwestern team, they're all very patient, they're all very kind. They go through this day after day, and I'm sure they're asked the same questions in a lot of cases, but I never felt rushed. I never felt that this decision was better than another decision. I was open to make my own decisions. I just felt at peace and at ease with my entire care team here at UT Southwestern. It's funny because now I have people who call me and they have just been diagnosed with breast cancer, want to know what to do, or they want to talk about DIEP flap or this or that. And I always refer them to UT Southwestern, Dr. Wooldridge for your breast surgeon to get that cancer out, and Dr. Haddock as your plastic surgeon. He will put you back together. I've also had other breast cancer survivors. Honestly, this may weird people out, but they want to see my reconstruction. And then they show me theirs, and theirs looks like a botched job. I mean, I hate to say it, but it makes me sad that not everybody is as fortunate as I was. And I've had many people say, I wish I would have had those options. I didn't have those options. And I guarantee, my daughter said this to me too, if I would have gone to that first surgeon, I would not have had those options. It's just a more complete package here at UT Southwestern, from the beginning stages when you're first diagnosed to your surgeon who's going to get that cancer out, to the plastic surgeon, and if you need radiation or chemo. I fortunately didn't have to go down that road. And honestly, that was one reason I chose mastectomy, because I didn't want radiation. But those decisions are personal and individualized, obviously, case-by-case basis. But I can just speak to me. I'm very grateful for what the doctors did for me, and continue. I still follow through with care here, even with oncology. Not finished with all that yet, but everything's looking good, and I cannot be more grateful, more appreciative to everybody here at UT Southwestern. And Dr. Haddock really gave me my life back. I feel like I'm able to proceed like a normal person and feel like a normal person, which so much of this is a mental game. So much of breast cancer is emotional, and it's deeply personal, obviously, but it's how you feel. And when you come out of it feeling great, it's like, okay, I got this. I can do it. Good luck to anyone trying to make that decision. It's hard, but no hesitation with UT Southwestern or Dr. Haddock. Dr. Haddock, you were just a blessing in disguise that I didn't even know existed when I started all of this. Truly am forever grateful for your work. I don't hesitate. Anyone who talks to me about breast cancer, whether it's reconstruction, needs to be fixed, or a new diagnosis, I send them your way, and I will forever do that. I am so grateful after seeing other people's breast reconstructions that I came to you, because I'm well aware it may or may not have turned out like that, and probably would not have turned out the way I have. And I feel like I look better than I did before breast cancer. Obviously, as you age, things happen, body's not the same, but I am truly, truly, from the bottom of my heart, appreciative for your work and for you and Dr. Teosha. I actually never met him, I was your patient, but I thank you so much for bringing in whomever was needed. I will continue to refer people your way. Thanks again. I mean, DIEP flap is no joke. That's a serious recovery. The DIEP flap recovery is hard. I'm not going to sugarcoat it. It's a difficult surgery for them to do. It took them hours, but afterwards, you can't even stand up straight. And it takes, I think, around 10 days, if I recall, before you can even stand up straight. I kept doing what the doctor said, just getting up. At first, it's just walking around my living room when you're hunched over, doing the best moving the best I could. You have to sleep sitting up for 6 or 8 weeks. I don't remember, it was a while, because you cannot, well, in my case, I had double DIEP flap, so both sides were cut, so I could not turn over. So I just propped pillows all up around me, either in the recliner or in my bed, so that I couldn't turn over. I'm naturally a side sleeper, so just to prevent me from turning over. The doctor said to just walk whatever I could, try to do a little bit more each day, and I did that. So I wanted to talk a minute about recovery from DIEP flap. I think one of the biggest things is the walking that helped me. I didn't attempt to go outside until I could actually stand up straight. I didn't want to scare the neighbors. But I'll never forget the first day, and our houses are close together. I could only walk out the door and down one house to the next house over. And then I went back in my house, and every day I added on a house. You know, I think it took me like a week before I could walk my whole street down and back. But it seemed like after that, things started progressing. I would just say, keep walking, do what the doctors tell you to do. I did find propping up with pillows was a big help for sleep, because you can't turn over. Loose clothing, go on Amazon, buy cheap, big shirts that you're gonna throw away when all of this is over. But those were helpful. You're gonna be swollen, you don't want anything tight for sure. And mainly just do what they say, and week by week, it was amazing. Every week I was a lot better. I mean, I progressed pretty quick, even though it was a major surgery. All I know to say is do what the doctors tell you to do. Just the front. I'm cut here to here, hip to hip, completely across the front. Dr. Haddock had to make an incision from hip to hip, so completely across the front. My incisions go to each side of my hip for a double DIEP flap. When you first come out, you're gonna be so tight, your stomach so tight, feel like you can't even breathe. But that's why you can't stand up straight. It takes a little bit. And honestly, it probably took a full year before that loosened up. Gradually it does loosen, and you'll feel back to normal. Unfortunately, I've gained a little weight. Don't tell Dr. Haddock. But when you feel good, but it's great. And it's still, I would still say, it looks better than it did before I started this process. It's similar to a tummy tuck, but not. It's not like you're gonna have a perfectly flat stomach. You do have a bit of a bulge. I'm not sure however they do the incisions inside, but you will have a bulge, but I never had a flat stomach, so it doesn't matter to me. I would say this, if you have the time for the recovery, because you do need to allow yourself 6 to 8 weeks, I would say, that's a good way to go, because it is using your natural tissue. I didn't want to personally have to come in every 10 years to have if I had implants, to have those switched out, or if there were problems, rejection problems or whatever. I wanted to use my own tissue. So that's what attracted me to it. And even though it's a bit more difficult up front, it's a one and done. You don't ever have to return. That's the goal here. But whereas with implants, you never know if they're gonna have to redo them or if your body's gonna accept them or not. So that was the basis of my decision.